Right, we will go ahead and start. We are thrilled to have you join the Treatment and Recovery Resource Meeting. This meeting is a product of the Treatment and Recovery Committee for the Governor's Alabama Opioid Overdose and Addiction Council. These virtual calls are designed to provide valuable insights, resources, and support for professionals involved in helping someone gain access to treatment and recovery resources. Each meeting will feature 3 dynamic speakers representing different organizations who will share the resources they have available to support our important work in the field of treatment and recovery. These meetings will occur on the first and third Wednesday of each month at 12 p.m. So please continue to join us as they occur throughout the year and feature new agencies each meeting. The Zoom link will remain the same for each meeting this calendar year. Each agency will have about 15 minutes to share about their services, referrals, followed by 5 minutes for any questions our attendees may have. We ask you all remain muted during the presentations, and when we open up for Q&A, you can unmute yourself to ask a question, or if you like, you can put it in the chat box, and I will ask it. Whoever's presenting at that time will ask it. Without further delay, I'm excited to introduce 3 agencies for today, which is New Awakening Recovery Services, AltaPointe Health, and Cahaba Medical Care. And at the end, we'll hear from Randy Hall to talk about some of their new offerings they have going on currently. And so we will go ahead and start with New Awakening Recovery Services.
Good morning, or rather, I should say good afternoon. I'm going to start my share. Just one moment. Okay. First of all, let me thank you guys for inviting me here to represent New Awakening Recovery Services, Inc. My name is Doris Barron, excuse me, and I am the Resource Development Specialist for New Awakening Recovery Services. And it's our pleasure to be here with you this afternoon, I should say. Thank you. Let's start. A little bit about us. We are a 501c3 nonprofit organization located in the Birmingham, Jefferson County area. Our mission is to provide education, guidance, and support services to recovering women in healthy, sober living environments, and to offer community referral services to any individual that's looking for help with their substance use disorder. Now, our core values revolve around certain really key terms that we cherish: recovery, compassion, transformation, and community partnerships. They are a part of our guiding principles for our program. Our vision eventually is to have a holistic recovery support model. And we're continually working on that, which makes it conducive to the mental, spiritual, emotional, and physical, social, and financial recovery for anyone that we are servicing. These are key components of being able to reenter into society successfully. Our overarching goal, is a residential facility of our own where we would be servicing women and others. But in the meantime, we are working with other facilities, other partners that we work through their facility to provide our services. Women that reside, excuse me, just one moment. Women that reside in shelters and treatment centers along with their children. One of the most important inspirations for us is out of 2 Corinthians 5:17. Therefore, if anyone is in Christ, he is a new creation. The old has passed away, and see, the new has come. Our program offerings, as you can see under recovery services, there are a number of services that we provide. Individualized recovery plans, parenting classes, mentorship, along with all the others that you see here, recovery enrichment programs, and events throughout the community. Under career and job readiness, we provide support for those who are looking to get their GED. We help them with job search and or college application assistance. And we also help them build powerful resumes as they go out in their job search. Under the reintegration and reentry program, we offer job training opportunities after incarceration, court advocacy, and family reunification. All of these services are provided by our team members and community-based partnerships. Look at some of our programs and events. Recovery enrichment, where we work with women in facilities, residential facilities, to help them provide them with services and activities and events that help them grow their own self-esteem and get them or help them prepare for reentry into society. Our Change Your Mindset, Save Your Child parenting program works with those mothers who are parents, who are with their children or who may not be, to help them understand what their role as a parent really is. Community-wide Recovery Month event in September, where we bring together resources and partnerships from other organizations that we work with. We hear testimonials from those who have gone through our programs. This is a really wonderful event every September. Why is New Awakening needed? Well, let's take a look at this for a second. Substance use disorder. It continues to be not just a problem, but it's an epidemic across the country. Recent research shows that more than 700,000 people have died from drug-related causes since the 2000s. That's more than some people or some cities have in their particular locations. Each state in the country has started to show startling statistics regarding drug abuse. So it's countrywide. It's just not in our area, it's everywhere. In Alabama, as an example, the overdose rate of more than 768 people have died as a result of overdoses in the last year. That is astounding and also very disturbing. In 2020, it was reported that the drug overdose deaths in Alabama increased by 25%, which is the highest we've ever had in the state. What about the drug treatment assessment statistics? Well, the illegal drug trade is alive and well, very active in Alabama. In 2023, fentanyl and other opioids were recorded as the #1 greatest drug threat across the state. I would imagine it's not just here in Alabama, it's all over the place. Fentanyl and methamphetamines are continuing to show increases in abuse. Fentanyl is now being seen mixed in and or disguised with many illegal drugs. And people who are taking them don't even know they're taking fentanyl, and that is really disturbing. Drug use and violent crime, there's a connection. Drug use leads to many activities, behaviors that people normally probably would not participate in, crime in particular. Intoxicating effects of the drug makes people think that they can do things that they probably wouldn't even think of if they were okay. These graphs show drugs most frequently associated with violent crime and property crime in Alabama, per the number of law enforcement respondents. And if you take a look at this, methamphetamine, 47% of crimes that have been taking place in terms of violent crime is with methamphetamine as a driver. Down here in the property crime area, all of this is around Alabama now. And methamphetamines account for 66% of the crimes that are property related. So there's a direct connection between substance use and crime. The local statistics for Jefferson County, despite attention on homicides, overdoses are the leading cause of death, doubling since 2014 in the Jefferson County area. If you take a look at 2014 and then go over to 2022, the change, the increase is astounding. This is a very disturbing trend. In 2022, drug overdose deaths surpassed both gun and vehicle-related deaths in Jefferson County alone, 417 confirmed. 86% of confirmed overdose deaths in the previous year were linked to opioids, predominantly the highly lethal drug fentanyl that we spoke of before. The critical need for recovery organizations is paramount in this community. Organizations like ours and all of yours, we are needed desperately. Who is our audience? Women in long-term recovery, drug court participants, actually any individual that's seeking help with a substance use disorder or the stressors that are related to it are part of our audience. Who is our partners? I just want to say one thing about our partners. If we were not able to have these wonderful groups working with us, these are wonderful organizations, there would be very little that we could do on our own. We needed them. They stepped up to the plate and they have been fantastic. And I just want to put a shout out to them and show our appreciation. And we're talking about places like Jesse's Place, homeless shelter for women and children, the UAB Arts and Medicine Life University, Jefferson County Drug Court, the Lovelady Center and Alethea House, the residential services area facilities that we work with for many of our programs. This is our Change Your Mindset, Save Your Child parenting program. This is the program that I created from the book that I wrote and published back in 2021. And it talks about how your mindset drives your actions and your ultimate subsequent behaviors and how that drives how you parent your children. And we walk through a number of key points in the book that talks about those aspects of our parenting role. Our youth empowerment program is fantastic. It focuses, as it shows, on our youth. And I want to just say that that's an important component in my view, because we want to catch our children before they get involved in using drugs. And at that point, we have an opportunity to keep that from even occurring. So this is an important part of what we do, and I believe it's an important part of our overall support or efforts around the community. We have impact in the community in other areas as well, with pictures of our recovery enrichment program, classes, volunteering, and other ways of participating in community events with other organizations. This has been truly inspiring for us, and I, for one, am very grateful to be a part of this. Other areas that we have focused on in terms of community opportunities, working with other groups, being there with them to support their efforts along with them reciprocating and supporting ours. This is a collective effort, and we are grateful to be a part of it. Here we are again with other organizations and activities that we have participated in. For instance, our food giveaway events that we have participated with other community organizations to provide food for the community. And as you can see, we include our little ones in that process. This is a wonderful way for them to learn what it means to give back. Our volunteers and mission ambassadors are a great support system for us. We are so grateful for them taking the time and volunteering to work with us in all of the services that we provide. I truly thank them for being there for us. Our board of directors and our volunteers are all part of the team, and they are very active with us. And again, we definitely appreciate everything they're doing to support us. Now, we have a new organization or a new movement that we are calling the United for Change Coalition. And this takes a direct aim at the stigma around substance use. We want to help transform the conversation around substance use and its effect on mental health disorders. And by addressing the stigma, we hope to create a more supportive society. And we're doing that in several ways. Public education, where we are disseminating accurate information so that we can help to dispel the myths about substance use and the misconceptions about it. Improve mental health outcomes. We want to work through that process to help reduce the stigma around substance use. Early intervention. Again, when we catch it early, we have a much easier job of working with those who are heading in that direction. And that can prevent some of those conditions that may be getting from getting worse. And having normalized conversations, encouraging open and honest discussion about substance use and its effect on mental health. Want to join our Mission Ambassadors program? We would love to have you. These are some of the things that we are so grateful for from this group of people. They use their insight, their influence, and their position in the community to help us and others to understand what it takes to be a successful contributor to society. These are some of our program evaluations. This is such a wonderful way of learning how we are making a positive impact. When you get feedback like this from the people who participate in our programs, that invigorates us, that encourages us to keep going. And they also give us great feedback as well. We use that feedback to improve what we're doing. And I, for one, am really grateful for that. These are some of the testimonials that came from the parenting program that I facilitate. They have helped me tremendously to provide the services that they need across the board. The other thing that we feel great about and feel humbled by is the recognition and appreciation that other organizations have shown us for the work that we're doing. And let me tell you, that invigorates me as none other might, to let us know that what we're doing is making a difference for others. Now, this is our key takeaway. We want to solve the opioid crisis, but we've got to go beyond just addressing the opioid use and go in, dig deeper, and find the root causes, identify, acknowledge, and resolve the underlying problems that lead to opioid use. That way, we can remove any barriers that could be impacting the individual's ability to make healthier choices. These are some of the references that we use to help us with our statistics. And with that, I want to say thank you. I appreciate the opportunity to represent New Awakening Recovery Services with you. If you have any questions or any suggestions, we would love to hear them. Thank you so much.
Thank you, Doris. That was a great presentation. You had a lot of great information in there about your guys' program. And how do people contact you? What's the best way?
Well, you can contact us through our website. Hang on just one moment. I'm not bringing you guys up. Let me go back in. I'm going to stop sharing. All right, here I am. I'm sorry, would you repeat that question, please?
What is the best way to contact you guys?
Absolutely. You can contact us through the website itself. In fact, would you like me to bring that screen up again? I can share that particular screen if you like, that slide.
Yes, you can show people, yeah, what it looks like.
Okay, cool. I'll do that right now. And here it is. I'm going to go ahead and bring it up so you can see it. All right. And hide this. There we go. You can call us 205-977-0267. You can email us info@narerecoveryservices.org. This is our website link. You're welcome to go out to that link and take a look at our website, the things that we're doing. We're also on social media. Bring us up on Facebook, YouTube, Instagram, and LinkedIn. All of those resources are ways that you can get in touch with us. Okay,
Okay, I put the link in the chat box just in case anyone else needs that.
thank you. Thank you. So I'm going to end this. Okay.
right, so now we will go ahead and hear from AltaPointe Health.
Okay.
Good morning. I'm Misty Bowen. Let me see if I can get my screen going. Well, are y'all seeing my dog or are y'all seeing my slideshow?
We see a website link. Okay, now we see the dog.
Now you see the dog? Okay, try this. Now are you seeing the slides? Yes.
Yes,
Okay.
yes.
All right. So, AltaPointe was established in 1957, and AltaPointe offers a wide array of behavioral health services to adults and children. I'm mainly going to focus today on the substance use services. I'm Misty Bowen, and I'm the Assistant Director of the Substance Use Disorder Services. And below is our website where you can find more information about all of the services that we provide. We have hospital services, crisis centers, behavioral health outpatients, inpatients, substance use, and so forth. And just kind of jumping off of our first presenter, we understand that substance use, it's at crisis proportions, especially when it comes to you know the current fentanyl use. In my area, there's more methamphetamine use than there is fentanyl use, but fentanyl is just so fatal, and we know that from the statistics. And so it has a widespread impact, and it's a very complex condition to treat, but it is treatable, and people do recover. And that's the good news about this disease. For AltaPointe and our substance use programs, we provide first assessments, and we do the ASAM assessment. And at that point, we're trying to determine what level of care is best fit for the person that we're assessing, because we have three levels of care, but we do not have all the continuums of level of care. So we're trying to determine, is this person going to be a good fit for our program, or do they need something more intensive than what we can provide? If they remain with us as a client, then we develop a personalized plan of recovery and that ongoing support for them. And part of our services is the individualized counseling therapy. And these are some of the techniques that we use, the CBT, the DBT, the motivational interviewing, and many others. And we also provide group therapy in all of our levels of care. And, sometimes in that group setting, you have your clients, they start to advocate and empower each other. And so that group setting can be key sometimes, especially when you have somebody who's a little bit oppositional to treatment and you have somebody who's a little bit further along in their treatment journey. That's who they're going to listen to. They're not going to listen to me. I mean, let's face it, they're not going to listen to me. And along with that, let me say that we also have certified recovery support specialists. So the substance use programs that I'm going to talk about in a minute, in each one of those programs, we have a certified recovery support specialist, at least one embedded in each of those programs, because it takes all of us. And I tell our clients sometimes when they're like, what do you know? You just went to school. When you come to AltaPointe, you have not only the person who went to school, but you also have the person who's gone through the journeys, and sometimes you have both. So we're very proud of that, and that we can have our CRSS is mentoring our people through their recovery journey, and sometimes encouraging them to actually stay for the assessment in the first place. And as part of our treatment approach, we use medications for opioid use disorder and alcohol use disorder. And We use the FDA approved medications that reduce cravings and manage the withdrawal symptoms. But we do this along with the combined counseling and group therapy. So you're not just going to come in here and get the medicine and go home. You're gonna have to do both because we know that the research tells us that that's going to improve the client's outcomes. And so the medications that we provide, and we provide these medications basically as a service within any of our programs to those who qualify and believe that the medications are going to help them with their recovery. We provide Suboxone, and I have a little bit of a blurb about each one of them that you can read. But Suboxone is basically your daily medication. It's an opioid, but it's also got naloxone in it that gives it like a ceiling effect, so you can't take too much of it. And then we also have Sublocade. Sublocade is an injectable form of the buprenorphine or the main ingredient in the Suboxone. And that injection lasts for 28 days, and it gives them a stable state of the medication over that month period. And that's good for people who may not want other people to see them taking the medications. They may have children at home and worry about that. You don't have to worry about traveling. And with this medication, it has such a long half-life that there's not this immediate, oh my gosh, I missed my appointment in 2 days, or tomorrow I'm going to be very, very sick. You have like a grace period that you're not going to go into withdrawal. We also offer naltrexone. Naltrexone, the first two I mentioned are for opioid use disorder only. Naltrexone can be used for opioid use disorder or alcohol use disorder. And it for the alcohol use disorder, it reduces the cravings, and it also takes kind of the happy-go-lucky feeling out of drinking. So clients say that it really just kind of, it's like drinking tea or something. But it's also an opioid blocker. Naltrexone is not a narcotic, and naltrexone comes in a pill form, but it also, the medication below it, the Vivitrol, is an injectable form. And now this is around about a 30-day injection, and that we can use to treat both alcohol use disorder and opioid use disorder. We tend to use it more for our alcohol use disorder patients because it is a complete opioid blocker. You have to be free. You can't have any opioids in your system for 7 days. And as we know, sometimes with our clients, that's hard to do. So, but it is an option. And then I mentioned Campril and Antabuse. Those are also medications that are prescribed. The Campril reduces the cravings. Antabuse is the kind of old school medication that makes you sick if you drink alcohol. But these medications, like I said, they're embedded in all of our programs, and they're free to most of our uninsured patients. And just to give you an example, if you were to just go to your doctor's office and say, hey, can I have a shot of Sublocade? And you didn't have insurance, they'll be like, sure, that'll be $2,400. Thank you very much, just for the medication. So we're very proud that we're trying to offer all of the different paths to recovery, whether it's abstinence based or whether the medications, because we just want people to be healthy and living their best lives. AltaPointe recently became a certified community behavioral health clinic, CCBHC. That's a term that I think we're going to be hearing a lot about in the future. Right now, not all locations are CCBHCs. Our Mobile location is, and our Bay Minette location is. Those are the two that I'm affiliated with. And what we're doing with that is it's a total wellness model, and we're offering the substance use services, the mental health services, and the medical services in one place. And we have care coordinators who are overseeing this. So in our field and in the mental health field, I think we all know that's all been in the medicals compartmentalized. You go here for this, here for this, here for this. With the CCBHC, we're bringing all of that together in one location. And these are the services that we offer as part of our CCBHC model in Mobile. It's probably not a comprehensive list, but I can, you can look over that. But again, somebody can come here for a substance use disorder assessment, and while they're here, they can say, I think I'm at risk um, for my health because I've been out there in the streets and I'm a diabetic and I haven't had my insulin. We can walk them downstairs and say, here, this person needs to see a physician. So it's pretty neat. I think it's going to launch. It's launching throughout the state as we go along. But for our levels of care for substance use disorder services, we're very proud to announce that in September of 2024, we opened a withdrawal management unit, and that's old school term detox. So we have a 6-bed withdrawal management unit that offers medically supervised withdrawal from alcohol, benzodiazepines, or opioids. And it opened in September of 2024. We've served nearly 100 adults, but sometimes from time to time we have open spaces. I know there's long lists for detox. So, you're more than welcome. We'll talk about how to access those services. But we also have level 2.1, the traditional IOP services, and those. And I didn't mention, but the withdrawal management unit is free to everyone. It's under a grant with the opioid use disorder funds that were made available. So at present, that program is free to everyone. And our IOP is free or low cost to everyone as well. We have locations in Bay Minette and Foley, and it's pretty much your traditional intensive. You have intensive groups with individual services. Within that umbrella, we have our Special Women's Program, which is a grant-based program provided to women that gives gender-specific treatment. Because anybody who's been in this field a while knows generally men aren't going to talk a lot about trauma in a group setting. Women will, but they tend to only want to talk about that in with other women, and especially if they're talking about sexual trauma. So we focus that program on trauma, parenting, navigating DHR or the court systems, and either maintaining their families or that family reunification if they've come to us already with the case. And then we have level 1 outpatient services, which are free to anyone that meets our basic income requirements. And we have locations in Mobile, Baldwin, Sylacauga, and Coosa County. And we also have a level 1 adolescent program here in Mobile. And we have a contract with the Board of Pardons and Parole, and they have day reporting centers throughout the state. And we have level 1 programs embedded with those to work with those who are criminal justice involved. And so again, in any of the services that are on the screen, we can also give the medication-assisted therapy to them for almost everyone, no cost, or insurance-based. To get started, services with us is pretty simple. Call that 251-450-2211. Access Care Professional will walk the person through the process of which service is best for them and how to access those services. Then they'll come in for an assessment and begin the treatment that best fits their needs. And we have kind of a large, like I said, vast, a lot of programs. I'm here today. I'm going to drop my information in the chat to you, and I'm happy to be your concierge if you have any questions, or if you call and you're not getting the information that you feel like is appropriate for your client, then you're more than welcome to call me or email me, and we'll see what services we can get going. But here we have it. While we're here today, we can help people restore their lives and their relationships with others and get that lasting sobriety. We were talking today, we have a client that has been with us since the 1980s and is in that long-term recovery with that medication-assisted treatment. And, he's just living his best life, and it's just beautiful to see. That's all I have. Thank you.
Thank you, Misty. That was a great presentation. Does anyone have any questions for Misty at all? You can either ask them or if you want to put them in the chat. I included the phone number down below that she included. I know she said she'll put her contact information as well for you guys. All right. If anyone doesn't have any questions, and now we will hear from Cahaba Medical Care.
Hello, everyone. Thank you for inviting me today. I'm going to go ahead and share my screen. See if you guys can see that. Can you all see my screen?
Yes, we can see it.
All right. Well, yes, I'm Charity Laster. I'm Director of Behavioral Health for Cahaba Medical Care. I also serve on Cahaba's operations and executive team. So I'm going to focus mostly on our behavioral health department and our substance use treatment. Let's see. We'll go to our next slide. So Cahaba, we have 27 locations. The locations that are in green are our primary care clinics. We have some school-based health clinics that are in red, and then we have 2 dental clinics and a surgery center, and also have some pharmacies within our network. Cahaba, this is Cahaba's 21st year in existence, and I joined them in 2018, and our behavioral health department has really been established and around since about 2020. And during that time, we've exceeded national benchmarks with a focus really on depression, screening, brief intervention, referral to treatment for substance use, and medication-assisted treatment, mostly via Suboxone, but we'll talk more about that. Similar to the CCBHC model, we are mostly a primary care clinic, but we offer integrated services for behavioral health, and we offer that at all our locations. So any Cahaba medical care location, you could receive your medical visit and behavioral health at that same visit and at that same location on that same date. And so it's not disjointed, as Misty mentioned. But we also, as you see on the screen, have targeted certain populations as far as integrated perinatal behavioral health care for our maternity patients. So any patient that is coming to Cahaba for OB care would be screened for substance use disorders and treated throughout their pregnancy. We also have targeted just trauma-informed care, alternatives to opioids for pain management, complicated diabetes, and then, of course, just the integrated substance use this throughout all of our locations. We are accredited through Joint Commission for Behavioral Health, also for primary care, but then we also are Alabama Department of Mental Health certified at an outpatient level. So we do MAT via a lot of the same avenues as AltaPointe, but we also use, and abuse is not here, but naltrexone, buprenorphine, Sublocade, Vivitrol, and Subutex. And so any of our locations, we offer our hourly service for groups and individual counseling for anyone with substance use disorder. And then we can do medication-assisted treatment. In addition to the MAT services and hourly outpatient groups that we provide, we do some co-occurring care. So we have psychiatrists, we have 2 psychiatrists that work with children, adolescents, and adults. And then we also partner with UAB. I don't have Dr. Lily pictured here, but she does telehealth for us as well to see patients. That she's an addiction specialist who's a psychiatrist. And so she'll see any of our patients who have addiction and are having some co-occurring psychiatric disorders as well. We also have a psychologist on our staff, and a psychometrist. And we found a lot of our patients just have not been in care for an extended period of time. And so and some of them may have never been assessed for autism, ADHD. One thing that we found is that a lot of our patients with substance use may have been using Adderall and other medications. And so having a psychologist to be able to evaluate if attention deficit disorder is actually being diagnosed has been helpful to us. In addition to those services, the medical, the substance use, psychiatric, psychology care, we offer all of our patients, they receive access to our dental care, but then also food pantries, clothes closets, shower access, wash and dryer access at some of our locations. And then we provide transportation assistance to those patients. So anything that's needed for our substance use patients to get to treatment. One of the reasons that we offer that fully integrated process is to avoid patients having to get 2 rides to and from the clinic. If they come to our clinic, then they're able to get everything they need at that one time. And so we offer gas vouchers, Medicaid non-emergency transport, but then we also have Uber Health rides, and we Uber patients back and forth to treatment as needed. For our patients that are established with us, they receive access to those dental services. As you guys know, a lot of our patients haven't been in primary care. They also haven't received dental care. So for emergency dental services such as extractions, or they may have infections, they can receive those services at low cost. It's not no cost. Typically, we do have some in-kind funds for patients that we deem that we would, can pay for, but it is at a lower cost to get the extractions done with your team at Cahaba. And then finally, this is just kind of an overview of the price for our services, depending on your sliding fee. That's our sliding fee prices. For patients who are on our Department of Mental Health program, due to grants through Department of Mental Health, they are at no cost. So for those patients, but after that grant period is over with, we hope for patients to be able to pay at a low cost for the services that they need. And so if it's ongoing counseling, it's $15 for them to come in for their visit. And then their MAT would go up to $75. But if patients are not able to pay the sliding fee discount rate, then we typically work with all of our patients and can do payment plans for them. And I'll go back to the front because you can contact Cahaba. These are all of our telephone numbers for various locations, but then our main number to our call center is 205-926-2992. And a patient could just call that call center number to actually obtain an appointment. And they would get an appointment with their medical provider, and they'll get access to all the other services through that first visit. Yeah, that's all I have, Leah.
Thank you. And can you put that number in the chat as well, real quick? Thank you. All right, if anyone has any questions for Cahaba Medical Care, you can either ask them if you want or put them in the chat box. Either is fine. All right, if anyone doesn't have any questions, now we will hear from Randy Hall at APC. He's going to share about some new offerings, and some events they have coming up.
Hello, everybody. I'm Randy Hall. I'm with the Addiction Prevention Coalition, and I just wanted to talk briefly today about a few things that I've been doing since I joined the Addiction Prevention Coalition a few months ago. They're kind of new offerings. I think everybody's pretty familiar with the prevention work that we do in the classrooms and stuff. But in speaking with people, they kind of don't know about some of these other trainings and more peer support oriented things we do. So I just wanted to make everyone aware so that they could take full opportunity to sign up for these if they're interested. So the first thing is mental health first aid trainings that we do. These are trainings that are focused on recognizing the signs and symptoms of mental health distress or substance use, and then teaching people like what actions can I take in the immediate time frame to provide care until help arrives. These trainings are free. We will come to you to provide the training to all of your employees, to all of your clients, to really anyone in the community who's interested in receiving the training. We do 3 different types of training. We do training for adults, where we train adults on how to diagnose and help adults who are struggling. We do teen training, where we actually work with the teens, typically in a school setting. And then we do adults trained in youth mental health, so for adults who are working with youth. So I've dropped a link into the chat. If anyone is interested in those trainings, reach out to us. They're long trainings. They're about 7.5 hours long. We can do about half of it virtually, kind of on your own. And then the other half is instructor led, but it can be done virtually as well. So there's really no requirement that we all be together in one space. We also offer a QPR, question, persuade, refer training for suicide prevention. It's a shorter training. It's only 60 to 90 minutes. And again, that's all done virtually. And I dropped the link into the chat as well for that. All of these trainings are free. All of these trainings provide certifications upon completion. So I encourage you to check them out. Another thing that we've recently started doing is more peer support work. I kind of come from the peer support world. I used to work for an organization called Recovery Dharma, which is a Buddhist-inspired approach to recovery from addictions of all kinds. I'm also a smart recovery facilitator. And I'm a big proponent of the idea that for every unique individual, there will be a unique path of recovery that is best. And many people find a lot of healing in 12-step fellowships, but many people do not. Many people, that does not resonate with them. And to the anytime that you have choices, you are empowered, right? Choices are helpful and empowering to people on their recovery journey. So I have created and cultivated some spaces in Birmingham where we run these multiple pathways meetings, Recovery Dharma, Smart Recovery. We also have family support groups that are not Al-Anon, but are sort of more secular based. Many of these meetings are at the Moore Institute in Cahaba Heights. And as part of my new job with the Addiction Prevention Coalition, I'm kind of taking what I've been doing there and I'm taking it everywhere else. So like in the last 6 days, I've been to Bradford, the Fellowship House, Central Alabama Wellness, Harmony IOP, and just kind of going around and doing like a little sampler where I kind of talk about my story and then I kind of show them like, okay, this is what these meetings look like. And this is how they're the same. You know, they're all based on community. They're all based on self-reflective practices. They're all based on working with others in a reciprocal way, asking for help, helping others, and kind of giving people a little taste just to let them know there are other things out there to the extent that they're interested. And yeah, a lot of people, I've received a lot of great feedback about that, and we're going to continue doing that at recovery centers and treatment centers. So to the extent that you would like me to come to your treatment center, to your intensive outpatient program, to whatever it is that you're doing, or to speak to your counselors and to speak to your recovery support specialists about these programs so that they feel empowered to speak with authority about them when people approach them, I am open and willing to do that. Just reach out to me. The last thing that I want to talk about is our big End Addiction Walk that is coming up on Saturday, April 5th. This is kind of like the crown jewel of the APC calendar. It's when we try to convene everyone in the Central Alabama recovery community, treatment providers, counselors, peers, and then also the people who are actually in recovery, the recovery community. And we all come together in one place on a beautiful, hopefully a beautiful Saturday in early April, April 5th, to have a party, basically, to show people that recovery doesn't have to be boring. Recovery doesn't have to be isolating, and that we can all kind of convene together, create connections in the community so that we can form the coalition that can raise awareness and really combat the addiction epidemic in Alabama. So the walk takes place Saturday from about 10 a.m. to about 1 p.m. There is a networking night the night before the walk. In many ways, for resource providers, I feel like that's the more important event because everybody is convened in one place to share their ideas, to create that camaraderie and that connection. People register as teams for the event and they try to raise money for the APC. Also, we have resource tables and sponsors for the event. So we try to create one of the biggest resource rows of the year when it comes to addiction recovery. We typically have somewhere between 60 and 80 tables, I think, of people from around the state. Again, inpatient treatment providers, outpatient providers, various wellness centers, various fellowships as well, AA, NA, DAA, Recovery Dharma, they all come as well. And there's a program and several activities throughout the day. There's memory activities for those who have lost loved ones due to substance use disorder. And activities for children. It's a family-friendly event, and you can bring your dog even. So we hope that everyone will come. I sent an email about a week ago to many of the local treatment providers, basically seeking feedback regarding whether you'd like to have a table for Resource Row. To the extent that you have not received that or you do not know if your organization has received that, if you will drop your email into the chat, I will make sure to get that to you. And again, we just want as many people to come together as possible. I find that like collaboration will really benefit all of us in our battle against substance use disorder. And with that, I am finished. If Morgan has anything to add, I'm happy to defer to Morgan as well.
I think you did a great job. I have nothing left to say. Thank you, Randy. Please come visit us on that day.
Yes, thank you, Randy. I believe Vital will be joining. I don't know for sure if it'll be under my program or someone else will be, but I know someone from Vital will be there. All right, so we will go ahead and wrap up. Thank you for joining. We hope you're able to learn something new about a resource available to you in Alabama for treatment and recovery. Please join us for our next call that is on March 5th. It'll be at the same time, 12 to 11, same link. So please join us then. Thank you, everyone. Have a good day.